Hello, Dr. Loetscher here. I want to talk a little bit about anesthesia. A lot of our patients have questions about anesthesia and the types of anesthesia we offer here. It's a big deal. It's one of the big benefits of coming to an oral maxillofacial surgeon because we're trained in it. And we use it a lot for people's anxiety. A lot of people are nervous about procedures, so we put them to sleep and they pretty much have nothing to worry about. It's also used to have patients sitting still so we technically can do a nice job for surgery. And importantly, if you have a toothache or something, you're worried about discomfort or pain, you're going to be asleep, you won't feel anything. And so there's basically about 4 types of anesthesia we do. There are 4 types. One is general anesthesia, which is when we put you completely to sleep. The word general means you're all the way to sleep. And that's what we do the majority of our patients. If you go to the hospital and get an appendix out, you're put asleep with a general anesthetic. And you're sitting still as a patient. We can do a nice job surgically, so it's a really luxury for you, the patient, and for us. Another anesthetic we do, which is not quite as deep, it's a twilight sleeper. They call it a IV sedation or deep sedation. And for that, you're partially asleep. You don't have a breathing tube in. You may be a little bit aware once in a while during the procedure, but basically you're comfortable, and most patients feel like it took 2 or 3 seconds for the procedure, even though it might have taken 20 minutes or an hour or so. But you're awake enough that we can talk to you, but you're just comfortable enough you don't really care about what's going on. The third and fourth type are, the third type is nitrous oxide, which is basically a conscious sedation, laughing gas, along with local anesthesia. And the fourth is basically local anesthesia, where we numb you up. For simple procedures, taking a bump off your lip, that works fine. You can drive here and drive home. But really, one of the benefits of coming to our practice is I'm actually trained in anesthesia, board certified to the Dental Association in general anesthesia, and we actually put our patients to sleep. We have 3 nurses that work here, and it's one of the wonderful aspects of our practice. So we can put you to sleep, you don't feel a thing. You're sitting still, and especially for our implant patients that are very technically oriented operations, we can do a wonderful job. But we do a lot of sedations, and basically a lot of it's partly the patient's choice and partly our recommendation based on your health and the type of procedure you're having done.